Welcome back, everyone, to another exciting episode of We Heart Therapy. I'm your host, Anabelle Bugatti, and today's hot topic for your guide to therapy and coaching is eating disorders. With me today, we have special guest, Gretchen Hudson. She's a licensed marriage and family therapist in Newport Beach, California, and she's going to talk to us all about eating disorders today. Thank you so much, Gretchen, for joining us.
Oh, thanks for having me.
All right. So, Gretchen, can you talk to our viewers a little bit about what exactly an eating disorder is?
Sure. An eating disorder is basically when someone has thoughts about food, body, image, exercise, all of those things that are so pervasive that they cause that person to have a reaction, which is usually some sort of behavior. And that the longer that occurs and the longer they have those thoughts and those behaviors, eventually those behaviors will end up really impacting their life and impairing it some way. So it's not like you're upset and you go running one or two times. It's more like these are thoughts that are not going away, and these are behaviors that are becoming your life.
And it sounds like it all also centers back to an unhealthy relationship with food.
Exactly. Eating disorders are all about the relationship.
So I think most people in society are familiar with the terms anorexia and bulimia, but are there any other disorders that fall into those eating disorder category?
Yes, there's binge eating disorder. Then there's pragerexia, which is more of like an anorexia that occurs when someone is pregnant. And it can show up when they've had no eating disorder or sort of a recurrence as well. And then there's an overexercising, and right now we're looking at orthorexics a lot, which is kind of this obsession with healthy or clean eating.
That's very interesting, especially I'm a clean eater myself, although I don't think well, again, it's like, when does it border on a healthy lifestyle to I'm obsessed with it?
Exactly. So that's sort of that fine line that we're sort of trying to find all the time, because a lot of times the person who may be engaging in the behaviors, it feels fine to them, but to a lot of other people it doesn't look so fine.
Yeah, and in the end it could ultimately just be very unhealthy, just an unhealthy relationship, as we mentioned, with food.
Exactly. So the real problem occurs more when clean eating, or whatever the behavior is, becomes something that they can no longer choose not to do.
Right. Almost like an addiction.
Yes. It feels like they have to do it.
Yeah. So what types of mental or emotional issues often accompany or underlie an eating disorder?
Basically, an eating disorder is a coping mechanism to anything that's tough to deal with. So really anything can underlie an eating disorder. But accompanying, there's a lot. I mean, eating disorders run the gamut of different diagnoses, because anxiety is high, depression's high. Those are probably the two that are main. Body dysmorphia, or not being able to see the body correctly, is another one, but that's also in the criteria for an eating disorder.
Right. And so I think some of our viewers might be a little unsure of what body dysmorphia is. Would you mind sharing with them exactly what that means?
Sure. It's more or less having an obsession, or really thoughts that don't go away about a specific body part, or the body in general, that the person is convinced that it looks a certain way, and everybody else may be able to tell them that no, it doesn't, and they just are not convinced.
Right. And the point where it becomes unhealthy and a diagnosable disorder is where it's really interfering with their functioning and their day-to-day living. Like maybe they're starting to not go out in public at all because they're so terrified that everyone's looking at, let's say, their nose. You know, my nose is terrible. It's the ugliest thing. And I can't go to work parties. Now I can't even get a job. I just got to stay in my house all day, kind of thing. Right.
Yeah. And it just becomes this thing that you have to live around instead of living with.
Yeah, and that's so tough for, I know, many of our viewers. So can you help our viewers understand what are the most common types of models of therapy that are used to treat eating disorders?
It's pretty much treated very eclectically. Traditionally, there are 12-step programs which are more or less effective, but DBT, or dialectical behavior therapy, has has the most evidence behind it to be effective, because it's not focusing on changing the thoughts in order to change the behaviors. It's focusing on everything. A lot of the newer models are more holistic in the sense of they're looking at mind, body, and soul, and not just treating the singular symptoms, because the truth is that the whole system's kind of out of whack when you have an eating disorder.
Right. So it seems like some therapists might be more inclined to go after the thoughts that cause the eating disorder. Some therapists believe you don't need to go after the thoughts, you just need to change the behavior. And then other therapists are saying, no, hey, we need to take a holistic approach and look at all of it together.
Exactly.
Yeah. So, and depending on, I guess, what our client is going through, they may decide, okay, maybe I don't need to talk about my thoughts. I'm good enough with changing the behavior, but that may not work so well for other viewers.
Exactly. Every eating disorder treatment is really individualized. And that's sort of what's great about it, and hard at the same time, because everybody needs something a little bit different.
Right. And so let's talk about that a little bit more, because I know there's quite a range of treatment for those with eating disorders. From those who can just see a therapist regularly to those who actually need inpatient hospitalization at an eating disorder clinic. So can you talk to our viewers a little bit more about how they might know which is right for them?
Sure. The first line of defense is always going to be just trying to see a therapist individually and see if that's enough to get the behaviors to change. Because ultimately, the behaviors do have to change in an eating disorder. Those are the things that are actually standing in the way of actually doing some real work, because they are a coping mechanism. So
eating disorders are seen as sort of life-threatening, right?
Exactly. And if those behaviors can't be managed, or they won't cessate while someone is in outpatient treatment, you're going to have to look at a higher level of care at that point. And if anybody's life is in danger, they're going to go straight into inpatient, because we can't play around with that. They have to be stabilized first.
Yeah, so this may be like anorexics who may try to see a regular therapist, but maybe they have a problem maintaining a healthy body weight and they dip below what is really healthy, to the point where now their life is in jeopardy because of the eating disorder. And that's when they would need to escalate to a higher level of care, is what you're saying.
Exactly. And it doesn't even depend on weight so much. It's more of the medical markers that we're looking at, because it's not just for anorexia, it's for binge eating disorder and all of that, because when the body's out of whack, so is the mind.
Yes. And so what are some of the physical side effects that come along with that would, again, put somebody into that danger range of I need to go to an inpatient therapy?
A lot of times we're going to look at electrolyte levels. Heart rate is a big one. If it drops significantly low, we're going to put them in inpatient right away, or at least stabilize. There's a lot of different levels that they're going to look at, but those are probably the main ones that if you play around too much with it, you're looking at a heart attack or death.
Yeah, it's so important for someone who might be struggling with an unhealthy relationship with food to definitely get in and see somebody. So can you talk to our viewers a little bit of how therapy for an eating disorder can help, and why it's so important to specifically find a therapist who specializes in dealing with eating disorders?
Of course. An eating disorder is so tricky, because it is the only disorder that I know about, any illness truly, that its way of attacking the person is to keep them wanting it. Like someone who has cancer doesn't want cancer. They want to get rid of it. So an eating disorder is kind of a tricky being. The person itself who's suffering isn't, but the eating disorder is rather tricky. And so if you don't see somebody who's well-versed in how eating disorders play out, therapy is often not super helpful, simply because the eating disorder will speak words that sound really great and make the therapist feel like they're doing a really good job, yet they'll watch their client decline, and they'll miss all of the key things that are underneath. So to have someone really be able to understand and meet that person right where they're at, because it's really not about the food, but that's how it's manifesting.
Right. So food is just the vehicle through which the symptoms show up.
Mm-hmm. And if someone's not really in the know about eating disorders, they're really going to focus on the behaviors of the eating and not why those are there.
Right, right. So it's important to see a therapist who's specially trained in the knowledge that accompanies eating disorders, because it is so just its special own area.
Exactly. And treating eating disorders very much like a really difficult game of whack-a-mole.
Yeah.
So you treat one behavior and you hit it down and a bunch more pop up. So you have to have a know of what all is going to pop up or could possibly pop up.
Right, right. But if somebody is viewing this and they feel like maybe they do struggle with an eating disorder, is hope available for them? Can they overcome this?
Oh, of course. It's definitely something that once they get into it, it's hard. But as like anything, and yet it ends up being a great asset in their life because it can provide a plethora of skills to get through it. And they can use those and employ those in every other area of their life. I'm recovered myself, and I would actually tell you that it was probably the greatest thing at the same time as being the worst thing that ever happened in my life.
Mm-hmm. Yeah, so I hear that getting into therapy and seeking treatment for an eating disorder can really change your life and really provide you with some assets that can affect you permanently.
Oh, so much. And I think that for eating disorders, even if it's like the slightest disorder, get help early because it's a lot easier to beat it when it's something that's just sort of an annoyance and not something that has fully taken over.
Yeah, and I like that you mentioned that you at one point struggled with an eating disorder. And thank you for sharing that. So, that you have real firsthand experience with that.
Yeah, that's probably my biggest asset in the office because I can meet them right where they're at, which is tough for a lot of people because the thoughts do sound crazy. They sound unique, and we look at those people, or the outsiders look at those people and what they're saying, and they're like, you're just plain crazy, except those thoughts are real.
Mm-hmm.
They're completely 100% real to that person, and there is no speaking anything else in that. And if I can meet them right where they're at and get it, but also encourage them into doing behaviors that they know they need to do, that's my ticket into helping someone.
Excellent. So how can some of our viewers find a therapist in their area who specializes in eating disorders?
There's a few different avenues that someone can look up. NEDA, which is the National Eating Disorders Association. If they Google that, that will give them the ability to click on something and input their information. That clicks up, or it'll show up a bunch of different providers or support groups and various things in their area. IADEP is another one of those. It's IAEDP. If you Google that, that does the same thing. You can look for specific providers, as well as Psychology Today. They can, I believe that they can put their name in their location and then click on eating disorders.
Excellent. And probably a standard Google search as well for a therapist in whatever their zip code that specializes in eating disorders.
Exactly. And another good one is to just Google various eating disorder resource or treatment centers. And if they call them, they'll have a catalog to send them, or at least a referral source.
Excellent. Excellent. Now, if folks are in Newport Beach or Southern California area and they'd like to work with you, how can they find you?
It's probably easiest to get a hold of me via my website, which is www.gretchenhudson.com, or they can Google me. I also come up, and then they can call or look at Psychology Online.
Excellent. Excellent. So, and of course, we're going to put a link to your website in the drop-down box.
Thank you so much.
You're welcome. Thank you again so much for participating in our series and talking to our viewers today about eating disorders. It's such a special topic and one that I know many of our viewers struggle with. So thank you again for your expertise. No problem. As always, if you like what you see here today, more episodes are to come. Information for Gretchen Hudson will be down in the drop-down box. And don't forget to subscribe to We Heart Therapy. Sit tight, more episodes are on the way.